We might move on now to, I think Pam Hussey can't be here. So I don't know, Sharon, are you presenting?
I am.
Yeah,
I'm just, yeah, I
so that'll
can.
be
Do
poster 3.
you want me to do it, or would you prefer somebody else to go on?
Nope, you go ahead.
Okay, bear with me now. I'll just come back out. I should have actually presented this. Hold on. Okay. The proposal this morning, what we were going to do is present our centre, which is the Centre for Integrated Care. And even just looking at the group that has come here this morning, yes, some people know about us, but like all things, and I suppose, what happened there? Like all things, you know, since we haven't been in for the last 2 years, everything just gets merged off into their own corners. But we are the Centre for Integrated Care. We're the digital research centre based in the School of Nursing, Psychotherapy and Community Health. The director is Dr. Pamela Hussey. And our associate director is our good gentleman here, Dr. Anthony Staines. So we do have a nice complement of primary investigators in the centre, from not just the School of Nursing, but also from the business school, from computing, a number of individuals that are highly involved in digital health standards for the industry. So what I wanted to show you this morning is our website, which is managed by myself. And on this website, it's got all our information regarding our projects. Now, I know Claire and Katrina are coming up behind me here to discuss one of our projects called the Next Project, which she'll explain in detail. But just to give you a more indication of the work we're not just doing research, we are also working with alongside the school strategy on the undergraduate and postgraduate spiral curriculum. So we are trying to work our way through from this year. We have worked with Kira White for first year modules, and bringing in some digital healthcare, which I believe was quite successful. Now we will get feedback via a survey from the class, all going to plan at the end of the month, if not early in the new year. So Pamela is actively working with other individuals to continue the development of digital healthcare through the School of Nursing, Psychotherapy and Community Health undergraduate program, and also having a voice at the table for the postgraduate framework programs as well, which I think is really, really vital. More things to talk about. We also have an education stream. And more to do with the education streams, I said, as the postgraduate and undergraduate. We have developed a micro-credential, the brand new buzzword on the block. It is, for those who may not know what a micro-credential is about, it is done with the department called the Ideas Lab, based here in DCU, alongside the European framework to develop small pots of education, right up to what we have invested in is a 10-week teaching micro-credential. Master's level are the current students that are in the pilot group going through it, which will finish in January. Those that are attending are clinicians, not just from our own school, but from the RCSI and also from School of Computing here in DCU. And the principle behind this micro-credential is the development of clinicians to consider digital health in the future, the development of digital health, integrated care, sláinte healthcare, all those different words that we see bandied around in the news. It is this micro-credential's responsibility to upskill those that are currently in a clinical environment and are interested in digital health care, and develop it further for not just their local site, but obviously, hopefully, the bigger picture is for the national programme under Sláinte Care to get integrated care for Ireland. So we have a number of umbrellas, just to surmise, is we have our education, which I've just discussed. We've obviously got a research arm, which I've discussed as well. And we have a number of projects. Anthony is working on the Durante project, which is about 6 months or so on the go at this stage, I think, Anthony. And the next project, which Claire is going to speak about. And we also have another project called CSDM. We are working with St. Michael's House. We're 6 months away from delivering a report on helping them have integrated care for their clinicians. So what that means and what it has meant is that we have met with St. Michael's House, a core group of people based here in Ballymun. We have looked at their paperwork, their sheets of paper, what do they use on a daily basis to capture data belong to the service users. And we are trying to work with them and their IT department to develop a system that will be integrated, will be mobile access. So we have created a demonstrator. We have a gentleman called Dr. Savash Das, who is a research fellow working with us, who is doing all the computer stuff for us. He's doing all the technical stuff and developing this demonstrator is what we call it at the moment, but we would know it as an app. Hopefully, so that the clinicians would be meeting the service user, going through their individual requirements, speaking to them, ensuring that we have standards behind this to what we develop is of European quality. It is not just of DCU or St. Michael's House quality. This is something that can be integrated down the road for a bigger picture stuff for intellectual disabilities group in this case. So after that, all our information, if you ever want to connect with us, is we're dcu.ie/CEIC, nice and short and simple. We do have a Twitter account for those that run in the opposite direction when they hear digital healthcare. I always promote the idea that connect with us on Twitter or LinkedIn, or through the website. I'd like to say we're very active around the 3 sites. I develop the website consistently, keep it as active as I possibly can. We've got a standards page. Again, another dirty word. Everybody goes, oh, I don't want to know about them. But again, we have a lovely standards page there that give you some introduction to the subject. And also our projects, our Twitter information, our projects, everything, anything that you'd like to know about is think of digital health and integrated care, and come knocking on our doors, and we'd be more than happy to talk about the centre, just to tell you what we do. So maybe down the road, we're always willing to go in with people that feel they have an idea within their discipline that is maybe a clinical stream, but feel that a digital piece would be beneficial to them as well to enhance the proposal for funding. Please come talk to us. We're happy to talk to people, give our advice, and if there's a chance and an opportunity to collaborate, we'd be delighted, because Pamela, who can't be here, is actually talking to the UN this morning about similar conversations on standards, etc. So Dr. Pamela Hussey is going very far and wide with her ideas and her knowledge, which she's a great network with all of these subjects in hand, and she could talk the talk. So please engage with us. We've more than just even for information or advice or chances and opportunities we might be able to co-fund. So short but sweet, but there I am, CEIC, the Centre for Integrated Care for DCU.
Thank you very much, Sharon. That's really nice.